A subscriber left a comment on my channel and said that I should talk about how to write a night shift report. But I'm going to take it a step further. I am going to talk about report writing as a nurse generally. So let's get into it. Hello, my name is Molia Busari and I'm the face behind Nursing with Lights. This brand's aim is to make nursing learning easy and accessible to all nursing students who watch my channel. And in today's video, we're going to be going over the OG report writing. I don't know if you've ever heard this phrase, but in nursing, if it is not documented, if it is not reported, then it did not happen. And it is very important for you as a nursing student to learn how to write a very good report right from the onset of your career, because that report could be something that could help an investigation in the future or even get you out of trouble in the future. Trust me, sometimes as a nurse, your report might be your saving grace. So what exactly is a report in nursing? In simple terms, report writing is just basically how nurses communicate patient information between themselves and other healthcare professionals, like maybe a doctor, a physiotherapist, a pharmacist. Sometimes you may have to write a report for those people. So it's not just among nurses. So basically, it's just a way to communicate patient's information. And there are different situations or different scenarios where you will be expected to write a report as a nurse. So the first one is an admission report. And this is when a patient is either coming into the hospital, that is if you are working in a receiving ward or a receiving part of the hospital, or when the patient is coming from another ward or another part of the hospital into your ward. So you could be doing an admission from out of the hospital, and you can also be doing an admission from within the hospital into your ward, but they are both admissions. Secondly, you could be writing an incident report, and this is when something unusual or something unexpected happens, maybe like a fire incident or a patient falls or something that is not usually, like it's not a routine incident in the hospital happens, or when something like an emergency happens, it is like an incident that needs to be reported separately from whatever normal routine reports you do as a nurse. So an incident report is also a type of report. You can also write a discharge report, which is when a patient is either going back home or you're discharging them from your ward to another hospital. You could also be writing a transfer report, like maybe your a patient is going to leave your ward to another hospital, either for a procedure or to another section of the hospital for a procedure, and there are informations that needs to be passed on probably to the nurses working there. You can write like a transfer report. Though most of the times you would expect the doctor to write a discharge letter and a transfer letter, but sometimes in some situations there is also an aspect for the nurses to actually contribute in that report. Another form of report, which is the most common report, or the most common would be the right word, that you will be writing as a nurse, is a handover report, like shift to shift handover. Let's say you're doing morning shift and you're handing over to the person coming in for the afternoon shift, then you have to write a report. Then you write maybe a handover report for maybe when you're going from afternoon to night or from night to day shift, or if it's just you are working in a hospital where they just do like 12-hour shifts. So currently where I work, we do 12-hour shifts. So if you are writing a report, like maybe you've done your shift from 8 a.m. to 8 a.m. So that's 12 hours. Then you're handing over to the person that's going to do another 8 to 8. So that's like a full handover shift report. Then you can also write like within your shift report, like a report of something that is happening within your shift that you just have to document at that point in time that they can read. So there are different types of report. Even though the subscriber specifically asked for me to talk about night shift report, I just had to go over everything generally. Now, what makes up a very good report, or what are the ways that you can write your report and make sure that the report is good? So let's go to the components of good report writing for nurses. For the components of a good report, I am going to be using just the ABC. Now, there are different ways or different school of thought on how to grade if a report is good or not, but I'm just going to be very, very simple and straight to the point. So I'm going to be using ABC. A meaning that your report has to be accurate. It has to be accurate. You have to make sure that you are documenting the right thing. If somebody is falling on their right side, you document that the patient fell on their left side, that is a wrong report. It is no longer accurate. Or if something happened at maybe at a particular point in time, maybe at 8 a.m. and you're documenting that it happened at 9, that's no longer accurate. You are better off saying that you are documenting in retrospect because of probably the word activity. That's why you could not document at the exact time that thing was happening, because A lot of times it is not possible for you to document at the exact time that something is happening. So if something has happened maybe like an hour ago, and you're just getting time to get your documentation table, either you're documenting with the computer or you're writing it like handwritten reports, you can document that you're documenting this in retrospect happened like about an hour ago, and you're just documenting now because of what activity, then you go ahead. So it has to be accurate. B, it has to be brief. Now, I know you want to go into details and explain everything that happened, but if some information are more or less tautology, and you don't have to write it. For example, let's say a patient is goes into the toilet to pee, and you want to document that the patient has passed urine, maybe because the patient, or you were suspecting that the patient probably had urinary retention, and you want to know if that patient has passed urine. You don't necessarily have to say by 5 a.m. Patients stood up from their bed, took away their blanket, walked about 10 steps into the bathroom, opened the door, raised the seat of the WC, peed, spent about 5 minutes peeing, then after they are done, they flushed and that is exactly what happened, but you don't have to now write everything in details, because obviously you're just writing a lot of things that are not exactly relevant. So you can just go very brief. Patient passed urine, our patient was mobile to toilet and passed urine at about so time. Simple and short. It has to be very brief. C is that your report has to be clear. It has to be clear. And when I mean clarity, I'm talking about first your handwriting. It is very, very unprofessional for you to write a report, especially if it's a handwritten report, for you to make a report and your colleagues or other people who need that information cannot read it. It is very unprofessional. There is no point trying to like manage space when you're writing, or you're trying to make your handwriting look stylish in a certain way, and in the process of trying to make your handwriting stylish, people cannot read it. It makes absolutely no sense. It has to be clear. Your handwriting should be clear. You're a doctor and you're watching this, I'm not mentioning names, but some certain people, certain healthcare professionals are known to have unclear handwriting. So maybe you just send this video to them. Your report has to be clear. Another thing is that you don't have to use too many complex medical terminologies when writing reports. I know you were the best students in your class, or you are the best students in your class. You have studied the entire nursing dictionary and the entire medical dictionary. In fact, the medical terms, they are fighting in your head. So you know it too much. If they are not medical terms that people are familiar with, especially when it comes to abbreviations, please do not put them there. Don't write reports that somebody that is maybe you finish morning shift and the night shift nurse has to be calling you at home that hello, nurse Busari, please, what did you write? You wrote this abbreviation. We are not used to using it. We don't commonly use it in this hospital. Why did you use it? It has to be clear, and people should be able to read it. So ABC, accurate, brief, and clear. Components of a very good report. Now, let's go over to some, maybe I'll say cheat sheets, or I'm not saying I'm cheating, I'm not teaching you how to cheat, but maybe some guides to writing a very good report, so that when you want to write a report, you don't just go blank onto and start thinking, oh, what am I going to write? How do I start? What should I include? What should I exclude? And it makes it very easy. So the first acronym we'll be working with is ADMIT, for an admission report. A for arrival, D for diagnosis or details of presentation, I for investigations, M for medications, and T for treatment plan. Very straightforward. You don't have to write everything. Now let's talk about the A part of the admit, which is the arrival, where you can talk about the patient's name, their date of birth or their age, how they came in, who brought them in. Maybe they came in by the ambulance, maybe their family member brought them, their daddy, their mommy, or they drove themselves to the hospital, and probably the date and time that they came. So that is like an A section of the admit. Then when you now get to D, which is diagnosis or details of presenting complaints, you talk about maybe what they came in with. Maybe they came in with headache, fever, they came in with bleeding, they came in with a wound, they fell, it was a road traffic accident. You talk about probably the details of the presenting complaints. It doesn't have to be very, very long, but something that when another nurse reads it, they will understand why they came in. M would be medications or allergies. They could be that maybe the doctor has already seen them, or they've been reviewed and they've already been started on certain medications. What are the medications that they are on? If they have medication allergies and you are aware, you can also include that. I would be like maybe investigation. So you talk about their initial vital signs, the pulse, the SpO2, the temperature, the heart rate, the blood pressure, relevant findings. Maybe they've done x-ray and this is what was shown on the x-ray. Maybe they did their blood sample and this is what they got from their blood sample. And besides, I have a video talking about blood results you'll be familiar with as a nurse. I'll leave it the link up somewhere or down the description box below so that you can watch that as well as talking about whatever you have checked. It could be maybe, especially if it's like in a condition like midwifery, you may have to start putting in their gravidity, parity, anything that they've seen. You can put it there as well. So the next thing would be the treatment plan. What has been done, or what did they plan to do? Have they been placed on oxygen? Has CPR been done? Have they been resuscitated? Have they been started on IV fluids? Have they been started on IV antibiotics? Or they are waiting for them to get transferred to another place? Have they been moved to maybe a female medical ward? Maybe they came in through A&E, they have done the admission and now they are moving to female medical ward. Maybe that's the plan for a bed in so ward, or they are to be started on IV fluids, they are to be this, or they are waiting on them bringing something. You just need to know, okay, what is the plan? Or maybe they are waiting for the consultant to review them and they've been stabilized. So this is more like a very simple way to understand an admission report. Now let's talk about an incident report. For the incident reports, we'll be using the acronym FACT. F stands for fact. That is who, what, where, and how. Like what happened, who was involved, this was patient, a staff, date, time, precise location. A for actions, like what did you do? Let's say, okay, what happened was that there was a fire incident, or somebody's phone charger exploded, for example. Whose phone charger exploded? What did you do? Did you unplug it from the wall? Did you tell people to leave the ward? Did you evacuate patients from the ward because there was like a fire outbreak? What did you do? What were the actions that you took as a nurse? Did you have to call the security to come and check? Did you have to call another member of staff? What exactly happened? Next would be C, which would be consequence or the patient outcome. Was there an injury? What exactly happened? Did the patients now require a new medication because of the incident that happened? Maybe the person fell and now the person is in pain and now the person has to get painkillers like paracetamol or whatever they are on. Also talk about the time. What time did it happen? Were there any witnesses? Is there any evidence? Maybe a CCTV or things, or maybe somebody recorded it on their phone. If there's evidence or witnesses, yes, you can also document that. Next would be probably suggestions, next steps, or things that should be done. Now, when it comes to this incident report, aside from this fact acronym that I've given, some hospitals already have like a checklist. They already have it written out and printed out for you. It's just lying maybe somewhere in the matron's office that you just go and pull it out and you write it and fill it. So you may not have to start thinking about all these things that I'm saying if the hospital has already provided it. And I think I prefer situations like that, because when the fact sheet is already prepared down for the nurses, they just pick it and document it, and it makes their work very, very faster, like very, very quick. You don't have to start rambling your brain and start thinking back or trying to remember everything. It makes it very, very easy. So if you're a matron on the ward and are watching this, you can actually try to implement this in your hospital. Try to create like a fact sheet for incident reports, make photocopies of it and keep them in your office to make work easier for your younger nurses. So another thing I'll talk about would be the handover shift report, and I'll be using the S bar. This is very, 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 very common, which is situation, background, assessment, and recommendation. For situation, you talk about, okay, this, maybe let's say you are a nurse now, you are handing over a patient from the accident and emergency ward. Person is going to the female medical ward, and that's where you're handing over. You talk about the situation. Okay, Mrs. Lakwaja has come in. When she came in, she said she had headache, and when they did CT scan or X-ray for her, this was what we found. And after we found this, they said, okay, we have to place her on these medications, and now she's for a bed. Now talking about the background, you also talk about relevant backgrounds of the patient. Maybe they have some past medical history that is related to what the current presenting complaint. You can talk about that. Then you also go and talk about maybe anything that is in the background. Because I don't have like a patient that I'm working with, that's why I'm just wrapping my head to see if I can pull up relatable examples. You know what I mean? But with the background, you talk about the past medical history. What are they going? What is going on? Like, is it that the person is pregnant, the person went home, they fell down, can you call? But in their previous pregnancy, they already had cesarean section, and now they are worried that okay, maybe the person is already a high risk pregnancy. Things like that. Just give us background information. Then assessment. What has been done? What has been done? What are the vitals? What are the blood results looking like? What are the scan reports looking like? That is the assessment that has been done. Then recommendations, like okay, we are bringing the person to your ward, we would recommend that you keep this person on a bed that is close to the nurse's station so that you people can observe her closely. We are recommending that she should be placed on maybe 2 hourly monitoring. We are recommending that this person's BP should be done every 2 to 4 hourly. The patient is actually bed bound, though there is risk of bed sore, so we recommend that you should be turning out 2 to 4 hourly, like recommendations and plan of care. So that's the SBA. I think I've talked a lot in this video. I don't think I've ever taught anybody report writing. This is a very new topic for me. Since I've been an online nurse tutor, I've never taught report writing, and I'm very glad that I was able to teach this topic. So if you enjoyed the video, please don't forget to subscribe to the channel. You can check the links in the description for access to website practices, quizzes, ebooks to help you prepare for exams, and all the resources we have. Thank you for watching, and watch this one more videos. Check this. Bye.